Hi, I'm Debbie Statler, editor in chief of Provider Magazine with the American Healthcare Association. Today I'm joined by David Shepard, head of sales for MatrixCare. Welcome, David.
Hey, Deb. Good to see you.
As a former chief operating officer of a skilled nursing organization and now head of sales with MatrixCare, you bring a lot of leadership experience to the table. What are some common operational challenges in skilled nursing that you now see could be addressed with the right technology?
Yeah, really good question, and I do have a unique perspective. I've had quite the odd career trajectory where I've worked in sales, worked in skilled nursing facilities as an administrator and a chief operating officer of a smaller regional organization, and then spent a lot of time in the technology world. And what that's done is it's giving me a very unique view of the world. And when I'm in these meetings all the time, I catch myself saying, "Gosh, if I just would have had access to this when I was an operator." And I often think about how it could help operators. So putting it in the context of your question of going, what are a couple of areas? I think two that come to mind. There's multiple with all the challenges that operators have today, but two that come to mind quickly are compliance and analytics. And so we think of it a couple of different ways. When we go to the sort of the lowest common area of compliance, and then I think of this, predominantly from an EHR perspective. So your EHR is the predominant technology platform within your organization, of course, supplemented by other technologies as well. But what we've seen is that a lot of operators don't necessarily use the tools at hand to monitor compliance. And so that's one of the toughest areas. There's so many requirements on things that they have to do, that I would say the utilization of compliance related fields are critical. So making sure that they're diving in using that. Another is analytics. And when I say analytics, it can mean a number of things. Is where we've kind of transitioned from not having many tools in the way of analytics to having so much information that it's hard to decipher the information and know what there is to do with it. So I think using the right technology to get the right information to the right stakeholders is a critical component of understanding what's going on within your organizations.
Absolutely. I agree with you. There are many things today that I wish I had before, would have made things a lot easier. Well, workforce issues are top of mind for pretty much the whole industry at this point, and obviously culture is a big piece of that. What are some suggestions that you have to foster a stronger culture of innovation and technology adoption within an organization?
Yeah, just straight from the hip, dig in. Just get as involved and as entrenched as you possibly can. I think a lot of times people think of this as something that they just have to do, that they have to have. But I would say to foster a culture of innovation where everybody is taking ownership of each component, that you see that your technology provider should be a partner in your operations with you. So figuring out how to get each person involved in the segment that they're responsible for, and making sure that each level of leadership is also involved in that. And I think an important way to do that is showing them exactly how it solves their problems. What are you going to use the technology for, and how does it impact them personally? So I think once people see that it's not that hard, it's not difficult, that you involve time and that you get everybody involved to make sure everybody is utilizing the components of the software solutions that they have.
Absolutely. There's no substitution for folks jumping in and really using it and seeing how it helps them in their day to day work. Well, taking the perspective of what you know now, how would you have handled data management and analytics differently to better drive decision making?
I think it's critical to identify the data that's most important to you. Partner with your EHR vendor, make sure that they're capable of getting the information that you need. So I think one of the things that I would do differently, or one of the things that I would do if I were operating today, is I would customize it per stakeholder. You don't just go, hey, here's your analytics. Here's what it gives you. Good luck. Go decipher all this information. I think you have to look at it per stakeholder. And what I mean by that is what the CFO wants to see and what the chief nursing officer wants to see are obviously two different things. What the COO and what an administrator may want to see are different things. What the director of nursing needs to see from a field level is different than what the CNO may want to see. So, really gathering the data that's critical to you and having it presented in a format that's meaningful to your staff so they can use it to make critical decisions.
I couldn't agree more that the needs are different and therefore the approaches need to be different. Well, let's talk interoperability. How would you suggest better integration and interoperability between different technology systems within a facility?
I'd start by bringing all stakeholders to the table. And I think this is an area where we've seen significant advancement over the last 10, 15 years, where there used to be a point in time where the integration was really tough or just didn't exist, to where all the major players now that are connected to the EHR, most of them are positioned to be integrated with the solution. So I would say make sure that, before you make any decisions though, on what partners you may choose to integrate with your EHR, that you talk to your EHR provider about what you're trying to accomplish. There may be the chance that what you're trying to accomplish already exists within your EHR, or if not, they'll have a good line of sight to what partners may help best achieve what you're trying to achieve. And so ultimately, if I'm the operator, I'm going, okay, I'm trying to solve a problem here. I need everybody to come together to make sure that we have the information that we need. So I would just keep an open line of communication, bring everybody to the table to make sure that it delivered in a way that was meaningful to that organization.
Well, you touched earlier on the partnership between the technology vendor and the facility. What are some thoughts that you have as far as starting that partnership, vendor selection, budgeting, sort of the logistics behind getting that partnership off the ground?
I see it from two angles. One, what is the technology component? Is it a good company that handles most of the things that I want to handle? And then what happens after the sale, which is as important, if not more important, than the first component. And I think if I were to go through a search today, I would start with going, what problems am I trying to solve? Like literally laying out what are the top problems that my organization is dealing with from every level within the organization, making sure that the CNAs have a voice, that the nursing staff has a voice, the social services, dietary, that all components of it, up through the corporate office staff as well, and go, what are we really trying to solve for? And then during that vendor selection process, to just lay it all out there. That you should trust with who you're working with and say, hey, here's what we're trying to solve for. We know everybody does the basics pretty decently. But when we're trying to solve for these very specific, very difficult problems, what can that vendor or partner do for you? And I think that's critical. It's very important not only to understand exactly what your EHR provider can do, but more importantly, what it can't do. And there should be an open dialogue about what that is and what it's not, so that there's no surprises at any point moving forward. So, kind of once you've established that, if you realize that it can solve the problems that you are, is that what happens after the sale? What does the implementation process look like? Don't let anybody tell you the implementation is easy, because it's not. It's difficult, but if it's done well, it's an opportunity to reevaluate your operational workflows. Again, going back to those problems that we're trying to solve for, how do you take the solutions that are offered, apply those to the problems that you're solving, and during your implementation process, roll it out in a manner that allows you to develop operational workflows that solve those problems and meet the basic requirements that you have. So that's getting you set up, and that's good and fine. But once you're set up, what happens after that? What if you need help? There's going to be things that are going to get missed. There's going to be things that people don't understand. And there's just going to be things that systems simply don't do. How do you handle those? And then what is the ongoing outlook? What's the connectivity level? Is it, hey, we're going to have webinars, you guys make sure you join to keep up? Or is it more engagement with the stakeholders that you met with? What's this handoff process going to look like? What are we going to do 1 quarter from now? What are we going to do 6 months from now? What are we going to do for a year from now? How will I know about new offerings? Will those new offerings cost money? Will they come as upgrades? I think it's just very clear to have a written plan of what your relationship will look like going forward. And I think if you do all that thoroughly, you should have a really strong look at making a right selection.
Well, you did mention communication, and that certainly seems like a foundational piece of keeping that partnership going.
And what I would say is it's critical to get each level of leadership involved in the engagement. So often this turns into a technology play. Well, it is absolutely a technology solution, but it's an operational tool. So, and hey, handing it off to the tech team to make sure that it gets deployed properly is one component of it. But if you don't have buy-in from every leader, every level of leader within the organization, it's not likely going to be successful. So, going all the way down from the facility level to all your department heads, having each department head involved and engaged in making sure that the teams are using the tools that are available. So, you do that all the way up through, if it's a single organization, then you're covered. But if it's a multi-facility organization, going, okay, what about the regional manager or regional vice president that organization reports to? Is the administrator and director of nursing really engaged? Because those are the tools that are going to help them. Then is the regional manager or regional vice president helping support them? And then on up through the corporate staff. So just getting every level of person and leadership involved to ensure that all stakeholders are using all components of the tools that they have available to achieve solving for some of the initial problems that you set out to solve to start with.
Absolutely. Participation up and down the leadership ranks. I couldn't agree more. Well, David, thanks for being with us today and sharing your perspectives on technology and adoption. I think it's been really great and something that everyone really needs to keep top of mind.
No, it's been my pleasure.